This medication, Estarylla, is a combination hormone medication used to prevent pregnancy. It contains two hormones, a progestin and an estrogen. In addition to preventing pregnancy, Estarylla may also make periods more regular, decrease blood loss and painful periods, decrease the risk of ovarian cysts, and treat acne. It's important to note that using this medication does not protect against sexually transmitted diseases. The recommended daily dosage is 1 tablet taken at the same time every day, and it is best to take it with or without food. Be sure to follow the instructions provided by your healthcare provider for the best results. Before you start taking Estarylla, it's important to read the patient information leaflet provided by your pharmacist. It contains important information on when to take your pills and what to do if you miss a dose. Make sure to take this medication by mouth as directed by your doctor, usually once daily at the same time each day. If you're taking the chewable tablet, follow the manufacturer's directions for your brand. It's crucial to continue taking this medication exactly as prescribed by your doctor, and to take it at the same time each day, 24 hours apart. Your pill pack contains 21 pills with active medication and may also include 7 reminder pills with no medication. Take 1 active pill once daily for 21 days in a row, and if you are using a product with 28 tablets, take an inactive pill once daily for 7 days in a row after you have taken the last active pill unless otherwise directed by your doctor. If you are using a product with 21 tablets, do not take any tablets for 7 days unless otherwise directed by your doctor. You should have your period during the 4th week of the cycle. If this is the first time you are using this medication and you are not switching from another form of hormonal birth control, take the first tablet in the pack on the first Sunday following the beginning of your menstrual period or on the first day of your period. If your period begins on a Sunday, begin taking this medication on that day. For the first cycle of use only, use an additional form of non-hormonal birth control for the first 7 days to prevent pregnancy until the medication has enough time to work. If you start on the first day of your period, you do not need to use backup birth control the first week. If you have any questions, ask your doctor or pharmacist for more details. If you experience nausea, vomiting, headache, bloating, breast tenderness, swelling of the ankles or feet, or weight change, you may want to contact your doctor or pharmacist. Vaginal bleeding between periods or missed/irregular periods may occur during the first few months of use. If you miss 2 periods in a row, or 1 period if the pill has not been used properly, contact your doctor for a pregnancy test. This medication may raise your blood pressure, so it's important to check it regularly and tell your doctor if it's high. Serious side effects to watch out for include lumps in the breast, mental/mood changes, severe stomach/abdominal pain, unusual changes in vaginal bleeding, dark urine, and yellowing of the eyes/skin. In rare cases, this medication may cause serious problems from blood clots, such as deep vein thrombosis, heart attack, pulmonary embolism, or stroke. If you experience symptoms such as chest pain, confusion, sudden dizziness, trouble speaking, or vision changes, seek medical help immediately. If you notice any symptoms of a serious allergic reaction, like rash, swelling, severe dizziness, or trouble breathing, seek medical help right away. This is not a complete list of possible side effects, so if you experience anything not listed above, contact your doctor or pharmacist. If you're over 35 and use tobacco, you should not take Estarylla. This is because smoking while taking hormonal birth control can increase your risk of serious health problems such as stroke, heart attack, blood clots, and high blood pressure. The risk of these problems increases with age and the amount of cigarettes you smoke. It's important to avoid smoking or using tobacco while taking Estarylla. Before taking Estarylla, make sure to inform your doctor or pharmacist if you have any allergies to estrogens or progestins, or if you have a history of certain medical conditions such as blood clots, high blood pressure, cancer, diabetes, or liver disease. If you have diabetes, monitor your blood sugar regularly and notify your doctor if you experience symptoms of high blood sugar. Also, be cautious if you have diabetes or phenylketonuria, as chewable tablets may contain sugar and/or aspartame. Let your doctor know if you are planning to have surgery or will be confined to a bed or chair for a long time, as this can increase your risk of blood clots while using Estarylla. It's important to limit your sun exposure and wear sunscreen while using this medication, as it may cause dark areas on your face and skin. If you wear contact lenses, be aware that Estarylla may cause vision problems, so contact your eye doctor if you experience any issues. If you are planning to become pregnant, be aware that it may take longer to conceive after stopping Estarylla. It's also important to use reliable forms of birth control while taking this medication, as it should not be used during pregnancy and may decrease breast milk production. Always consult with your doctor before making any decisions regarding pregnancy or breastfeeding while using Estarylla. It's important to be aware of potential drug interactions with Estarylla. Some medications may change how Estarylla works or increase the risk of serious side effects. Always keep a list of all the products you use and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. There are certain products that may interact with Estarylla, including aromatase inhibitors, fezolinetant, aspemifene, tamoxifen, tizanidine, tranexamic acid, and certain combination products used to treat chronic hepatitis C. Some drugs may cause hormonal birth control to be less effective, increasing the risk of pregnancy. Examples include griseofulvin, modafinil, rifamycins, ritonavir, St. John's wort, drugs used to treat seizures, and HIV drugs. If you start any new drug, be sure to inform your doctor and discuss if you should use additional reliable birth control. Also, let your doctor know if you experience any new spotting or breakthrough bleeding, as these may be signs that your birth control is not working well. It's important to note that Estarylla may interfere with certain lab tests, potentially causing false test results. Make sure that lab personnel and all your doctors are aware that you are taking this medication. If someone has taken too much Estarylla and is experiencing severe symptoms like passing out or difficulty breathing, it is important to seek immediate medical help. In the U.S., you can call 911 or your local poison control center at 1-800-222-1222. In Canada, you can call a provincial poison control center. Symptoms of an overdose may include severe nausea and vomiting, as well as sudden or unusual vaginal bleeding. It's important not to share Estarylla with others. While taking this medication, it's essential to have regular complete physical exams, including lab and/or medical tests like blood pressure, breast exams, pelvic exams, and pap smears. Make sure you follow your doctor's instructions for examining your breasts and report any lumps right away. It's also important to keep all medical and lab appointments. If you have any concerns or need more details, consult your doctor. If you miss a dose, refer to the product package for guidance. You may need to use an additional form of birth control, like condoms or spermicide, to prevent pregnancy. If you have trouble remembering to take your pills, talk to your doctor about using a different form of birth control. Make sure to store Estarylla at room temperature, away from light and moisture. It's important not to keep it in the bathroom, and always keep it out of reach of children and pets. When it comes to getting rid of any leftover medication, don't flush it down the toilet or pour it into a drain unless specifically instructed to do so. Make sure to properly dispose of this product and it's expired or no longer needed, and you can consult your pharmacist or local waste disposal company for guidance on how to do so. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.